Advanced providers sometimes use a continuous positive airway pressure device, commonly known as CPAP, when managing patients with moderate to severe respiratory distress. This is an advanced skill that you might find yourself assisting with as an EMT, so we will cover it here. These patients will generally present with tachypnea and use of accessory muscles along with other signs and symptoms consistent with asthma, COPD, or heart failure. Before we start, let's make sure we have the right candidate for this procedure beyond simply being in respiratory distress. For a patient to be able to use CPAP, the answer must be yes to the following questions. Is the patient awake and able to follow commands? Is he or she able to sit upright in a Fowler's position? Is their systolic blood pressure above 90? And the answer must be no to these questions. Is the patient actively vomiting? Is there evidence of airway obstruction as the cause of breathing difficulty? And lastly, do you suspect the patient has a pneumothorax or significant trauma? If our patient is eligible to use the CPAP, let's begin our skill. Let's practice body substance isolation and don our gloves and eye protection. We want to make sure our patient has supplemental oxygen via a non-rebreather or face mask with a nebulizer in place while we are getting our equipment ready. If they don't need a non-rebreather for their respiratory distress, they probably don't need CPAP. If it has not been done already, these patients should also have continuous monitoring with an end-tidal carbon dioxide nasal cannula, a pulse oximetry, and an electrocardiogram. If you anticipate a patient will need CPAP before advanced providers arrive, it is very helpful to put the patient on the monitor. Although most devices are very similar, we should always follow the manufacturer's recommendation and know our equipment. This CPAP comes with two components: the face mask with an attached forehead stabilizer and straps, and a corrugated expandable tube with an attached bacteria filter and PEEP valve. We are going to attach the oxygen tube located at the end of the corrugated tube directly to the oxygen source on the wall or oxygen tank. A 50 psi source is essential for the CPAP to work, so let's not attach it to the flow meter. Now we are going to attach the other end directly to the mask. We will feel air coming out of the mask. The next step is best accomplished with two providers. Let's remove the non-rebreather face mask. The end-tidal capnography cannula can be left in place. The first provider, usually the more advanced provider, will be holding the face mask firmly in place over the patient's nose and mouth. These patients will usually be very anxious, so it is imperative that we calmly explain the procedure as we are performing it. As the patient begins to feel a little more comfortable while feeling the pressure from the mask firmly on their face, we will tighten all the straps around the head. After the straps are tightened, be sure there is very minimal, if any, air leaks around the mask. While monitoring, we should see improvement in less than 5 minutes. Let's leave the mask on until we transfer care to a provider in a hospital or if the patient deteriorates. If our patient worsens or becomes unconscious, we need to remove the mask and assist with ventilations with a BVM and an airway adjunct like an NPA or OPA until a more advanced provider can maintain the patient's airway with an advanced airway, such as an endotracheal tube, or until you arrive at the emergency department.